Every day, you look in the mirror. You see your eyes, ears, nose, and mouth. You are aware that your brain is thinking. But have you ever wondered what else is going on inside? Your head and neck are divided into different areas. The first and most familiar one is the oral cavity. Second is the pharynx, or throat. Then the larynx, also called the voice box, the paranasal sinuses and nasal cavity, the salivary glands, and finally, the thyroid gland. All of these areas in your head and neck work together in synergy, so the body functions well. Most of the conditions that affect the head and neck, like colds and sore throat, are easily diagnosed and treated. But if you have a lump or a sore that does not heal, a throat pain that does not go away, difficulty swallowing, and a hoarseness or change in your voice, it is best to consult a doctor that specializes in head and neck surgery right away, because these symptoms may be early signs of cancer. In the oral cavity, the cancer may present itself as a white or red patch on the gums, the tongue, or the lining of the mouth. It can also cause swelling of the jaw, unusual bleeding, or pain in the mouth. In the pharynx, cancer symptoms include trouble breathing or speaking, pain when swallowing, pain in the neck or throat that does not go away, pain, fullness, or ringing in the ears, or trouble hearing. Hoarseness and pain when swallowing may be caused by cancer in the larynx. Cancer of the paranasal sinuses and nasal cavity may cause one-sided nasal obstruction, nose bleeding, swelling of the eyes, or other eye problems. It can also cause pain in the upper teeth. Cancer of the salivary glands causes swelling under the chin or around the jawbone, numbness or paralysis in the face, or pain in the face, chin, or neck. A lump in the neck and changes in your voice may be caused by cancer of the thyroid. If you have any of these symptoms, it is best to see a doctor immediately. What causes head and neck cancer? At least 75% of head and neck cancers are caused by tobacco and alcohol use. People infected by the human papillomavirus, especially HPV-16, are also at a greater risk. Other factors that increase the risk of head and neck cancer include consumption of betel nut, excessive consumption of preserved or salted foods, poor oral hygiene, occupational exposure to wood dust, radiation exposure to the head and neck, infection with the Epstein-Barr virus, Asian ancestry, particularly Chinese ancestry, is also a risk factor. The treatment for head and neck cancers depends on a number of factors, including the exact location of the tumor, the stage of the cancer, and the person's age and general health. The doctors and medical professionals at the Medical Cities Cancer Center take a multidisciplinary approach to the diagnosis and treatment of oral, head and neck cancers. Because you are a partner in managing your health, you, together with your multidisciplinary team, decide what course of treatment is right for you. This may include surgery, radiation therapy, chemotherapy, targeted therapy, or a combination of treatments. The Medical City makes sure you consider all treatment options carefully. Each type of treatment is explained, and changes in the way you might look, talk, eat, or breathe are also discussed. In partnership with you, the Medical Cities Cancer Center will do all it can to make sure that you keep a healthy head and neck on your shoulders.